And I think that's based on basically two reasons. One reason is a sense of social justice, that no citizen, that it's not right that society has people that really lack access to these basic things. Some of them, which are even basic for life. We can't live without air, we can't live without water. And yet, so access to water seems natural. That's a real public responsibility. And you could extend that to health and so on. The second reason, I think, is based in economics. That the alignment in these basic things between the good of society and the good of the individual is actually 100%. So basically, you can't have 100% capability to compete in a globalized economy if your citizens are lacking these basic things. So in terms of, I've spent learning about education for the last several days in Brazil. So as you all know, Brazil's education improved a lot in the last 10, 15 years, from really terrible to just terrible. Because actually people didn't have schools, and now there's a school. But the output of that school will matter if Brazil in the 21st century is going to move to a value-added nation or not. So all these things that are basic for everybody aligns with what's basic for an individual. So that's why I think everybody recognizes this is public sector responsibility. So why bring about the private sector? We need to address business and these basic things for two reasons. The first one is that if you view the world at the street level and look at how the majority of the world lives, and the majority of the world, it's the 4 billion or 6.5 billion people in the world that are low income, that are badly served to atrociously served. If you look at the world from their eyes, the market is present all the time. Every daily interaction is happening in the market. Because other than the United States, Canada, Western Europe, New Zealand, Australia, and Japan, and some other little conclusions that you can make to that list. Most people have what they have because they pay for it themselves. The social safety net, a functioning social safety net, does not exist for the majority of the world. And even something like bolsa familiar, which has been introduced, as you know, is of recent vintage. And this applies to almost everything. So, just to give you a sense of what this means in quantitative terms, there have been some attempts in recent years, some research studies, trying to quantify what that market is. What's the market of the 4 billion people of the world that are badly served? And basically, if you look at this market in nominal dollars, it's in a very conservative estimate, in my view. A study has tagged it as around 1.2 trillion. But if you adjust it for purchase price parity, it's much closer to 5 trillion a year. And there's a market for everything, for water, for health. And for example, if you look at health, the poorer the country is, the more the reality is that it is transpiring in the market. So if you take a poor country like India, actually of the dollar spent on healthcare, 76 cents is being spent out of pocket and in private area. Only 24 cents occurs in the public sector. If you go to the developed countries, States, Europe, 80 cents of that dollar is spent by the public sector. So what it means, actually, it's quite interesting, is that all our great public health schools, from Harvard Public Health, Johns Hopkins, all the discussion, almost all the discussion in the United Nations, World Health Organization for the poor is taking place 24 cents of that dollar. 76 cents of that dollar is being spent by poor people that are trying to consult doctor buying medicine in some parts of Africa. One of the problems is 50% counterfeit false medicine. But the reality is the poor are paying for that health care. So one big reason to talk about this is that's what reality is. But the second reason, I think, is one of real, at the heart of real social impact. Because if you think of these really basic things, and you say, what do we want from these basic things? From the eyes of the poor, for the eyes of 80% of the world, I think they want four things. First is best, the best intervention possible, whether it's education or health or housing, whatever. Right? The best possible, cheapest, universal, everybody has access, and urgent. Right? So the key question is, if these are the four things that determine the success we want out of these basic things. And I think one problem of the public sector being responsible to deliver that is that whenever you talk about these basic services in any country like Brazil or India or Mexico, you're talking about 75–80% of the population that is really badly served. So anything you do is very big. So it stretches the budget. It's a real tension between all the other priorities of the state. And also, what you have is when the state is a direct deliverer of goods and services, it is difficult to think that the delivery will get better and better consistently with time, or cheaper and cheaper consistently with time. So some of us think that when the state is a direct deliverer of the good, sometimes the best it will be, the cheapest it will be, is the day it opens the door, and then it degrades for a lot of reasons. Manila, by 1999, got into a huge crisis. Water was failing, it was municipal, it was getting worse and worse. Manila has about 60% of the people in Manila are poor. 40% of Manila has some connection access to water in 1999. And I leave to you to guess which part of Manila was getting the connection to the water. It was such a crisis that finally the municipality of Manila said, let's privatize water. And they divided Manila into two parts. One part was given to a consortium led by Suez, the French global multinational, with some Philippine partners. And the other part of Manila was given to a consortium led by the Ayala, which is a large Philippine industrial group, with some foreign technical providers there with expertise. 13 million people, 8 million was in the Swiss side, about 5 million were in the Manila Water, that's the company side. After 7 years, the Suez group came back to the municipality and said, here are the keys, we're leaving. We've lost money every single year, this is horrible. We just don't know, we won the licitation, but we're leaving. What happened on the other side, Manila Water? Manila Water, when they took over, was just the same disaster. Of all the water running, you could only invoice 37%. The rest was lost, leakages because the pipes were bad, or it was stolen, or whatever, but you only invoiced 37%. Bloated bureaucracy, etc. It was losing money. That first year they lost $1 million. 7 years later, they had spent hundreds of millions of dollars of capital investment. They extended new piping equivalent to 1,900 kilometers. So that was 30% of the existing network was added. They got from people having 24 access to water was only 26% of the people. And you can imagine what neighborhoods had that access. They extended it to 98%. And that extension was to basically 1 million families. So basically, it meant universal access to water 24/7. The difference, it was also very interesting because when you're poor in Manila, the rich turn the tap and they get water. The poor, before this, had to pay 7 times the price because they were buying bottled water from sometimes people that stole it from there. So the sewage connections increased dramatically, and by 2005 they reached international standards of water a year earlier than projected. So basically the water, that 24/7 access and all that, is as good in Manila as in India. You can drink it, it's high quality. Now the interesting thing is, this is all regulated, as you can imagine, water. Now when Manila Water goes to ask for an increase in rates, the community organizations are present, but they're present to support the request of Manila Water to increase the tariff. And from losing $1 million a year, 7 years later, Manila Water was earning $49 million net. I do think that Brazil has a much more balanced population in some way or another, and it also has so credit for the poor, I think, has been extended in different ways, probably more than in other countries, certainly more than in Mexico, and more a Brazilian model to be developed that will be different than the models that have succeeded in elsewhere. And also that Brazil is very large, so that there may be regional models. And since Brazil is very large, and Brazil has a lot of population, regional success could be just as large as national success.